Welcome to today's webinar, which is titled Virtual Connection and Loneliness During COVID-19 Among RTO ERO Members. Today, we have a very special treat because we have two presenters, Dr. Paula Rochon and Dr. Rachel Savage. I would like to mention just a few things up front, and then I'll introduce the ladies properly. My name is Joanne Murphy, and I am Chair of the RTO ERO Foundation Board of Directors. I'm really happy to be hosting today's webinar, which is the second in our 221 webinar series. The mission of the RTO ERO Foundation is to foster respect, self-determination, better healthcare, and social connection for older adults in Canada. We are one, in fact, of a very small number of foundations to invest exclusively in initiatives related to healthy and active aging. This is now our fourth year of planning and hosting webinars, and we're happy to continue bringing interesting and relevant topics and presenters to you through this format. Okay, on to today's presentation. Now, let's get to why we're here today. Our presenters, both will be familiar to many of you, and we're very happy to have both of them with us today. I will start with Dr. Paula Rochon. Dr. Rochon is a geriatrician and a senior scientist at Women's College Research Institute. She is also the inaugural Retired Teachers of Ontario Chair in Geriatric Medicine at the University of Toronto since 2015. Her research career focuses on understanding the unique needs of older adults, particularly women. She is one of the leading Canadian health services researchers in geriatric medicine. In particular, her research explores how to promote health and well-being in older adults by optimizing their drug prescribing. Dr. Rochon is a great friend to the RTO ERO Foundation, and we are so happy to have her with us again today for this webinar. Next, we have Dr. Rachel Savage. Dr. Savage is an epidemiologist and a research scientist at Women's College Research Institute. She has over 10 years of local and provincial public health experience. Her research aims to improve the health of older adults, immigrants, and women. She is the principal investigator of a national study funded by the Canadian Institute of Health Research that explores how loneliness and social isolation affects how older adults use the healthcare system. She is also a collaborator on a transnational initiative to explore medications safely in older women and men. Dr. Rochon and Dr. Savage, thank you so much for taking time to join us today. I will now turn the presentation over to you.
So thank you so much, Joanne, for the lovely introduction. And we're delighted to be here today and to be able to talk about some of the work that we've all been doing together. So we're going to be speaking today about virtual connection and loneliness during COVID-19, specifically among older adults living in the community. And so, Joanne, as you mentioned, we're going to be doing this along with Dr. Rachel Savage. And on the screen, you'll also see Sophia De Nicolo, who is a fourth-year student from the University of Toronto, who's was working with us on this project and led a lot of the work that you'll be seeing today. She would, of course, have joined us here today, but she's actually working on the front lines and so was not able to be here for this presentation. And we also have Dr. Andrea Lawson with us today, who is the research lead working with our group, and she'll be available to assist as well and was very much a part of the project. So today, the objectives that we're going to be doing are, first off, I want to spend a few minutes highlighting a little bit about the RTO ERO chair and some of the collaborations we've done to date, because we've done a number of things together, and we'll talk about those briefly. And then we want to talk a little bit about the COVID-19 online survey that many of you participated in. And then we'll talk about some next steps in supporting the RTO ERO membership. So one of the things I like to think about with the work that we've been able to do with the RTO ERO, it's a great idea, a great opportunity to put science into practice, basically. So by working with the RTO members and staff, we've been able to get such amazing insights into issues that are really important to all of us. And so what we're looking at here is by working with you, we've been able to gain information that's informed the science that we're doing, created new findings, and coming up with information that's really going to be improving health. And throughout this, we've involved trainees. So the study that we're going to talk about today and the work that we're going to talk about today has really followed this whole process that you've very much been informed or been part of working with us to create this work. It's informed the science, and these findings are coming back to hopefully help us all do better during this COVID-19 time. And we've involved trainees in just about everything we've done. And Sophia is one example of a person that's been part of this process in this particular case. So when we think about the different kinds of engagements that the RTO has been involved with, I just want to remind you that way back when I started in this role of a chair, we sent out a survey to the RTO membership about your interest in getting involved in research. And all of you said, yes, you wanted to be involved in research and to help in that process. And so it's been really wonderful to be able to do that. A number of you were part of focus groups that looked at issues around aging. And then a number of you have been involved in this survey on loneliness during COVID-19 that we're going to be talking about specifically today. And as well as that, the RTO has been involved in some nationally funded projects that we've been working on, receiving support from CIHR, our federal funding agency, to help us understand better about medication safety and also issues around loneliness in older people, which we think are so important. And then by working with the RTO, we've been able to find ways to get this message out, both to the RTO membership, but also to get our messages out much more broadly about the work that we're doing. And as I've said, we've now involved many different trainees in all aspects of the research process. And those trainees are now moving into their own roles in terms of leadership positions that they're taking on. So it's an exciting opportunity, and we're so thankful for all of the work that we're able to do with you, the RTO ERO members. So with that, we're going to now be talking about work that comes out of a survey that was done on loneliness during COVID-19. And perhaps with that, I can turn it over to Rachel Savage, to start continuing the conversation.
Sure, thank you, Paula. So Joyce, can I ask you to advance the slide, please? Thank you. So I think one of the features of the research that we've been able to do to date with the RTO community that Paula has mentioned, one of the great things is that this research is really truly collaborative. And by that, I mean, we work together right at the start to define what our questions are, what would be relevant to members, and work together to develop a protocol, and throughout the research process to check in with RTO leadership about what approaches might be best and work well for the membership, and to, of course, share results at the end and get feedback from you all. So I guess now more than a year ago, at the start of the pandemic, we really saw a need for research that helped us understand how the COVID-19 pandemic was impacting older adults. At the time, there was a lot of early web-based survey research that was starting to come out in the literature about how people were, being personally affected and how they were coping with the stress and the anxiety of all these unknowns. but there really wasn't a lot of detail on how older adults were experiencing the pandemic. And you can imagine that that was primarily a function of how this research was being done, which was mostly online. So we knew we had a really amazing opportunity with to collaborate with RTO because so many of the members are online. We thought we could, quite rapidly be able to turn around and collect data on how people were experiencing this event and how they were feeling and things like that. So we quickly talked with Jim. He was very enthusiastic about the idea, and we worked collaboratively to develop a research protocol, which was approved by Women's College Ethics Board. As some of you may recall, the invitation went out to RTO members to be involved in a survey, I think in the late April or early May of last year. And then we implemented the survey over a 2-week period. So we have been analyzing the data, and it's really been very rich and helped us understand a lot of different components. You may remember that I presented some findings on loneliness last fall. And today we're going to focus on more of the aspect of virtual connection and the use of technology. So as Paula had mentioned, Sophia was really the trainee that led a lot of this work. She actually conducted a lot of these analyses as part of her 4th year research project. And she was supervised by Paula, myself, and also Dr. Vivek Goel, who is now the president of the University of Waterloo. So we are really pleased to have her lead this work. And again, she wishes she could be here today, but she has presented these findings to Jim. So the question that was really guiding our work was around the use of virtual connection and how members were maybe using technology to reduce or combat loneliness during the pandemic. We wanted to understand what online and technological strategies older adults were using at the beginning of the pandemic. So remember, this was the period of time, May 6th to May 20th of 2020. So we were about 7 weeks into the pandemic. We were in a provincial lockdown here in Ontario, but I think it was, pretty universal across the board. And we were supposed to be remaining physically distant, which meant most of us, our only way of connecting with others was, by phone or through some of these online technologies. And we really wanted to understand what barriers people were facing if they were trying to use technology. So we're going to present some of that work today. We looked at 3 questions specifically in our analysis that were relevant to our research question. Maybe I'll start with the second question, which is how we really measured the technology use. So we asked the question in the survey, do you use any social networking websites like Facebook or apps, for example, Zoom, to communicate with friends and family? So we didn't ask explicitly whether this was a strategy to use to combat loneliness, but it really was about, the use of technology to facilitate this virtual social connection. And then really to understand some of the barriers to that use, we drew on other questions that we asked throughout the survey around age, sex, living arrangements, people's internet connection, access to a smartphone, and some other factors that I'll present on in just a minute or two. We also were interested in looking at 2 other questions. One, the first, which was, what steps do you take to avoid feeling lonely? And we were interested in that question because we had a free text, an open-ended comment box underneath that, which really let people say what they wanted to tell us about what they were doing. And we thought maybe that would be fruitful in terms of people saying, you know, I'm hopping on Zoom, I'm using this technology. The second question we looked at, which also had an open-ended response, was what devices do you use most often when connecting with friends and family? And so what we did, in addition to, you know, our quantitative analysis, is that we went through those free text open-ended responses and looked for patterns in the data. So we did a thematic analysis, looking at how people were using technology and what people had to say about it. So I've presented this before, but this just slide shows who we talked to in the survey, who our respondents were. So we had a survey completion rate of 89%. So that's based on, you know, the close to 5,000 people who consented to participating in the survey, which was fantastic. And in the end, we had 4,879 participants that were included in our analysis. These results probably won't be surprising to you because they're really reflective, I think, of the demographics of the RTO ERO community. So the majority of respondents were between the ages of 65 to 79 years, so 67%. Again, the majority were women at 71%. 92% self-reported a white ethnicity, and 90% reported being in good health. Overall, about a third of respondents lived alone. Now, this is kind of really the heart of the results and what we found in terms of how people were using online technologies for virtual connection. So overall, the majority of respondents reported that they were using social networking apps or websites to communicate with friends and family. The overall proportion was 84.5%. Now, this table presents these findings stratified by women and men. So you can see that 87% of women reported that they use social media compared to 78% of men. So women were more commonly users of this technology. These findings present the age distribution of users versus non-users of social media. And you can see that it's actually quite different. Perhaps, again, as you would expect, we had a smaller proportion of adults who were aged 80 years and older who reported that they were users compared to those that were non-users. Again, higher again for men compared to women. And then similarly, there was a higher share of non-users who reported that they lived alone. So we had 49% of women who lived alone that were non-users compared to 26% of men. So we did an analysis where we looked at what factors increased people's likelihood for not using social media. Remember, our research question was really guided towards understanding what some of the barriers were of not using this technology. So I've kind of ordered these results so that the factors that had the greatest influence are at the top and we work our way down. So you can see that not having a smartphone was an important predictor of not using this technology. So those that did not have access had 3 times the likelihood of not using social media. Also, respondents who really infrequently communicated with friends and family compared to those that were, in touch with people most or every day were also had higher odds of not using social media. So more than double the odds. Again, as I had shown in the previous slide, age was a really important predictor, with those being, in the oldest age category being more likely to not use the technology. Living alone was another important factor, and it's certainly a very important factor in terms of loneliness as well. So again, those who lived alone had almost twice the odds of not using social media use and that related technologies. As I showed again on the previous slide, male sex increased the likelihood of not using the technology. Then there were some other factors that increased the likelihood of not using this technology, and that included not receiving any offers of assistance throughout the pandemic. So that may be an indicator of having low levels of social support. Also, if people reported having a moderate or poor internet connection relative to those that had a good or an excellent connection, that also made things more challenging. And people that were in poorer health were less likely to use this technology. You can see that loneliness really didn't impact how people were connecting. The odds ratio for that was 1, which meant there was no difference. When we looked at some of the qualitative responses, so the free text responses, we found some really interesting things. I think the first, overarching thing I want to highlight is that when people talked about technology, they talked about it in a really positive way. So overwhelmingly, the responses were positive in talking about, virtual connection. We identified 3 themes that I'll present some quotations on in the next slides. The first is this idea that virtual connection is really beneficial during this time. The second is the importance of this technology to help maintain pre-COVID connections and routines. And the last is maybe sort of the other side of it, which is, this virtual connection can be great, but it's not a replacement for in-person social interaction. So this first theme around the benefits of virtual connection, many of you commented that the technology that was available to you really helped you feel socially connected during that lockdown period. So you can see here a male respondent who said that Zoom has been a really good new technology for me. Another female participant said that Zoom, WhatsApp, et cetera, have been excellent platforms for keeping families connected and for maintaining social activities such as card games, yoga, book clubs, et cetera. The next theme was around maintaining connection and routine. So we were, people often commonly talked about using these platforms and technologies to kind of keep their daily routines going. And we've heard before that maintaining these routines are really essential for our mental health and well-being, especially during, these periods of crisis. And so people talk to us about how these technologies enabled them to still continue on a weekly basis, for example, having get-togethers with their children, partners, and grandchildren. It enabled people to continue activities like their book club, walking group, outdoor club, and meeting their monthly lunch friends. So it was really, for people that talked about it this way, a way of kind of keeping that consistency and routine to their daily lives. The last theme, which we heard from quite a few respondents, was that it's really not a replacement for in-person connection. And, I think many of us can resonates with us, that, despite all of these benefits, we're still craving seeing people in person. We're really missing giving people hugs, and just that in-person connection is really so important. So some of the members commented that texting and phone calls are great, but the one-on-one contact is missing. And the second quotation says, I try to reach out via social media to my best friend daily. I phone family members who are not on social media. However, regardless of the advances of social media, nothing will ever replace face-to-face contact or the human touch. We also asked people, and we looked more specifically at how people were talking about strategies they were using to combat loneliness who weren't using social media. What were people doing if they weren't using technology? There were a number of strategies that were raised, everything from exercise and kind of the more old-fashioned means of communication that are also really, really valuable and important, like phoning a friend, sending an email or a text, and also, using technology, but in different ways. So playing games on the computer, for example, reading, watching TV. We also wanted to hear from people that you weren't using this technology, but also were reporting feeling lonely. What were they doing and what were they saying? And in this group, which was quite small, but I think still very significant and an important group to look at, they were commenting that they really miss the daily personal contact with people in their lives. So, these might be people that would really benefit from having some social support to connect them to technology. They want to reach out, they want to establish those connections, but maybe they can't for some reason. And they're really looking for that connection to the outside world by doing other things. So they're reading, they're looking at newspapers and reading newspapers, and they're on the internet connecting, what's going on in the outside world. So I have to apologize. At this point, I actually have to, I'm doing a training session this week, so I have to leave, but I'm going to pass it over to Dr. Lawson, who is going to just sort of summarize some of our reflections, and then she'll hand it back over to Paula. So thanks again.
Thanks, Rachel. Hi, everybody. So as Rachel was noting, while the qualitative analysis was going on, there was this sort of recognition of certain particular themes coming out of the data that reflected experienced challenges of the pandemic. And actually not just personal challenges, but participants' identification of what some other individuals, other RTO members, other older adults could potentially be facing. As well, desires were identified. People sort of were talking about things that they were missing or wanting to have in the midst of this pandemic. And then what I loved was some participants came up with some ideas for helping individuals stay connected during this time, which was fantastic. So some examples of challenges is there was a discussion around how some older adults may be struggling, how there might be difficulties in accessing the internet, and people highlighted things such as geography, the cost of the technology, knowledge of its use, those sorts of things. And emphasize the need for multiple communication channels, not just sort of apps, or internet-based ones. So things like calling, writing, old-fashioned snail mail letters, things like that. And then a desire to stay informed and connected really came through quite strongly in the qualitative. And particularly information on self-care, not just physical care, but mental health care during this time as well. And as well, a desire for information on how to stay connected virtually, particularly among those who weren't so conversant. And then this third sort of theme where participants came up with ideas about how to stay virtually connected during this time. And one participant suggested tip sheets that could be circulated amongst the membership about, here's this app, and here's how you access it. Here's the website. Here's some troubleshooting tips. Here's this, website that you can use, that sort of thing. And then one that I absolutely loved, I thought this was a great idea, linking RTO members together. So for example, a very technologically savvy RTO member with one not quite so savvy, and in that way, you've built a connection and a resource for that individual who isn't quite so tech aware, to help that individual build capacity in terms of being able to connect with loved ones virtually. Yeah, I thought that was fantastic. And now I'll hand it back over to Dr. Rochon.
So thank you so much, Andrea. I appreciate that. So we've heard lots of information, and now we just want to talk a little bit about, some of the implications. And I think maybe we can sum it up by saying that these online strategies and technologies may be beneficial for some older adults to address loneliness. But I think one of the messages that does come up, is even though we can use these and we need to find better ways to use these, and we need to think about these tips that were just mentioned, but it's not always a replacement for in-person interactions. And I think we know that, but it was important to see this coming up in the work that we're talking about here. And I think the images are really quite lovely here, because it just does talk to, the idea that we do want to get back to that place where we have those personal connections. So some of the reflections, it's clear from the work that we've done and the survey that we've been able to do that many of the RTO members, just like many people across society, have been deeply affected by this pandemic. And reflecting on the responses that we've had to the survey, we see some differences between how some of the women and men have been affected. They've been affected in different ways, but in some ways they've also been affected in similar ways. But understanding these differences may help us think about how we might assist people with ways to cope. And so, there's, I think, a number of things that we need to reflect on here in terms of what we can do. And, while many older adults really reported feeling lonely during COVID-19, and this is an experience that I think has really been reflected by so many people, several features like, perhaps it's even worse for women, perhaps. And living alone, we found also was something that really increased the feelings of people who might be lonely. And so these do identify places and opportunities for us to think about how do we intervene and what do we do differently. So it might identify opportunities, strategies that we might want to put in place to find ways to reach out to these individuals and help reduce loneliness. And as you heard, some of these things maybe involve simple things like phone calls, things like that are some of the basic things that we're used to doing that might be strategies that we might want to think about. And the study, and I think this was mentioned earlier on, that the work that we've talked about today is part of the larger study that we did that was all about loneliness among older adults in the community during COVID-19. And so the piece that we talked about today, technology, is another piece of the information that came out of this much larger survey. But the study that we have here that's up on the screen was just published in the British Medical Journal this past month. And in fact, we just heard today that it's just been available online. So it's available, and I think it's so exciting to see this out there. It represents, information obtained from almost 5,000 of the RTO ERO members. And, a number of the RTO ERO leaders have been very involved in helping us work and design this study. So as I said, we're really excited to see this out and would really like you to see it and share this information. So it's available, and we'll make sure that you have the link so that you can access it as well. And I want to also just put out here some information about what supports might be out there that might be useful for members to have for other members or for other people around them. So I think one of the things that comes out of the work that we've done related to loneliness, and especially some of the pieces related to technology that we've talked about, it says it's so important, especially for those that are living alone. And we've got some information here from the WHO regarding recommendations around mental health that might be useful. And they're often just really simple things, like finding ways to maintain routines. You know, it's about, for example, maybe going out for walks at regular times, or connecting with people at certain times, but trying to do things in a regular way. And I think the idea, we've got it here in parentheses, about thinking about exercise is important. That's so important for mental health. And I know during the pandemic, it's easy to not be going out and doing some of these things, but it is a very good thing to do and to try to maintain. And it's also very important to connect with friends, family, neighbors. And we've talked about, you know, obviously this whole piece around social media, which is important, and thinking about what we do online, and that's important, but it might not be for everyone. And we need to think about some of the offline things that we might want to do. And I know Andrea mentioned the word, you know, things like snail mail and things like picking up the telephone. You know, these simple things work. And so we want to not forget those and think about that. And then sometimes, and I know I hear this in my own family, like, you know, sometimes listening to the news too much isn't necessarily what you all want to do. So maybe there's opportunities to think about other things that you might want to listen to that you may enjoy, like maybe it's music, or maybe it's films that like you like to watch, or other things. But those are some of the things that you might want to think about. So with that, I do want to thank so much the RTO ERO for all of the support that you've been giving us. And just to thank you, because this work really comes from our ability to work with you and to hear from you and to share the information that you've provided to help us find ways for people to connect during this time that's difficult for all of you. So thank you for all the work that you're doing to help us spread geriatric medicine research and science, you know, across RTO ERO, across Canada, and really across the world, with things like the publications that have come out from this work. So I think with that, we have provided a lot of different information, and Andrea and myself are here and available to answer any questions that you might have.
Thank you so much, Dr. Rochon, and thank you, Andrea, for stepping in to replace Rachel at this point. Okay, here is a first question to get started. What strategies to reduce social isolation and loneliness among older adults have greatest potential to minimize impact?
Okay, so thank you, Joanne, for the question. And maybe I'll reiterate a few things, and I'll ask Andrea to give her opinion as well. Andrea was very involved with a lot of the work that we've been doing here. But I think one of the things that we need to think about is, you know, as I think I mentioned at the end, you know, some of the things that help get people connected are really, really simple things, like phoning, talking back and forth with people. You know, it's not always about, you know, relying on online technology. So some of those very, very simple things actually really work. So I don't think we want to minimize that. They can be very, very effective. I also know that being somebody that's spending a lot of time on Zoom and things like that, sometimes it's actually quite refreshing just to have a phone call with somebody. So I think one of the messages is, you know, think about some of the simple things that work. And oh my goodness, isn't it nice to get a letter from somebody? I mean, it's been so long since we've had people writing to us. And this is such a wonderful opportunity to think about connecting with simple things like writing, which is something that I think people really appreciate. Andrea, did you want to comment as well?
Yeah, no, Ian, thanks. It's a Great question. Just from a very sort of straight up research perspective, I don't know of any research that's taken a look at different strategies to reduce social isolation and loneliness in older adults and taken a look at sort of their efficacy. So I don't think that work is out there, but I agree with Dr. Rochon that I would suggest a multi-pronged approach, and also keeping in mind that everyone is quite different, right? There are some individuals who have virtually no contact and don't feel the impact whatsoever, and others who feel it very strongly. So I do think a multi-pronged approach is probably a great way to go. But at the very minimum, I think that outreach, that initial outreach to individuals during times like these to find out what's going on, what does this particular older adult need in terms of connection, and then filling that need.
Thank you. The next question. Are you going to use this information in another study or program?
So thank you, Joanne. Great question. And yes, we're going to use it first off to find ways to write it up and to make it accessible to people to see, because I think it is so important right now. You know, people are interested in technology. You know, we don't know enough about where it works, how it works, all these different things. So we'll be using this information and writing that up, so that will be available for people to see. And I think that too sparks additional questions. As I mentioned, this came from the broader survey that was done of RTO-ERO members. And so it's just taking one little piece of that information, and there'll be other bits that we'll be working on from that survey as well.
The next question, this is excellent and timely work that could have far-reaching impacts. What plans are in place to diversify the population so that others could benefit, given that this was 92% white population?
So again, these are excellent questions. You know, we have done this work using the RTO-ERO membership, which is, you know, gets reach across the country, which is great. But I think you're right. This membership does not reflect everyone in the province. I mean, there's many people in the province, for example, who you know, don't have the same kind of education that the RTO membership has, and maybe come from different kinds of backgrounds, or perhaps English isn't their first language, or, you know, or they may be living in areas where they have less access to technology, or maybe don't have the resources to be able to have that kind of technology. So I think you're right that we need to look at how this works in people that are different perhaps than are those with the RTO-ERO membership. Part of this is being done related to some of the loneliness work that is underway across the country, which is looking at a more diverse group. But I think your point is very well taken. There's much more to be done in terms of learning about how this applies to the population more generally.
Thank you. In the survey, was family support questioned? I phoned hundreds of RTO members in my district twice during the pandemic. On the second call, I asked about vaccination, and no one with family had any problem. Never married women were the most, however, I think is supposed to be, married women were the most needful of help and connection.
Okay, so maybe I'll start, and maybe Andrea can jump in as well. But one piece of that question, and there's a lot of pieces in that question related to the idea of vaccines and who might be able to access vaccines. And so while we've looked at the use of technology as it relates to connections, which are super important, we realize that this information is, you know, useful in a variety of other ways. So for example, if you're not really using connections using social media or online kind of technology, that could be very much a problem for other things that might be much more common or even happening now that didn't happen before. So for example, the whole vaccine piece and a lot of the registrations happening online, if you're not using technology, that's going to be harder for you to do that, especially if you don't have somebody to support you. So this does raise, groups that may be particularly missed out from important things. Also, perhaps relates to things like receiving medical care, because some forms of medical care now is provided virtually. And in order to access that, you may need help getting that technology in place. So while we've looked at it in terms of ways for social connections, the ability to connect online has broader implications. And therefore, we need to find ways to support people to get the things that they need, like vaccinations and for example, connecting to primary care physicians and things like that, who may or may not always have access to this kind of technology. Andrea, do you want to comment?
Yeah, no, not much more to add to what you just said, Dr. Rochon. To be very specific, the questionnaire itself did not specifically ask about family support. Family support was sort of packaged throughout the survey in terms of family, friends, and neighbors. So do you connect on a regular basis with family, friends, and neighbors, that sort of thing.
The next question isn't directly directed to either of you. It's more a question for RTO to answer. And perhaps if the questioner doesn't mind, we could type an answer afterwards. If that's okay. The next question, my husband contacted the virus. He was hospitalized for 4 days. He's now non-contagious. I tested negatively 2 times and I'm waiting for more results. I still have to be in confinement. I do a lot of activities that are shown in the survey. What I miss the most is not being active in my volunteer work in person. There isn't really a question here, but I think it's a good comment.
I mean, I think that is such an important comment. I think we've all had very different experiences during this pandemic, and it's been difficult on so many levels. So I sort of feel for this member who's brought forward their personal situation. And I think we all miss those important activities, the volunteer activities that allowed you to sort of connect in so many different ways, but also provided so much value to those around. And I think we would all agree that we are very much looking forward to a time when we're able to get together and resume those kinds of activities again. And hopefully with, vaccinations coming forward, that we can see that that's something that's now in the future.
Thank you. Here's another question. What recommendations would you make in light of your findings for strategies that RTO-ERO should be considering to ensure that our members' loneliness decreases as we come to the end of this pandemic?
So again, that's a great question. I'm sure RTO will have, ERO will have lots to say as well. So maybe I'll start that I think one of the things about RTO-ERO is that group is so connected already. And I think it's just set up in such an amazing way to support connections. So I think that's valuable. I think having things like what we're doing today, like a webinar where there's an opportunity for people to get together and for information to be shared and to ask questions, I think these are great kinds of opportunities. And I think the way that you're organized with your groups across the province provides basically a ready-made network to help with connections. And I know that the RTO is finding many different ways to support this kind of activity throughout the pandemic. And I'm sure there's many, many more things that will come and more things that we'll learn. But I think the RTO-ERO is such an amazing example of a group that does work very well together and does support these social connections through the way it's structured and the kinds of activities that they have. Andrea, did you want to add?
No, I absolutely agree. And what I know of the RTO-ERO and their sort of deep connection with their membership, I do think that you're fantastically set up to keep that up and maybe even increase it. One of the things that I noticed from the qualitative data is that some individuals even noted simply receiving information help with loneliness. I'm not saying that's, all you need to do and that's the end all and the be all, but I think that in fact might simply be a strategy is communication in and of itself around, webinars such as this one, tips and tricks to stave off loneliness, upcoming events, those sorts of things.
Thank you. Has there been any indication of people's growing, question disappeared. Has there been any indication of people's growing reluctance of making social contact as we've gotten used to things this way and doing anything else is too much work?
Well, that's an interesting comment. I'm sure some people have become, maybe a little bit resigned to the fact that they're not able to connect in a way that they might have. And I do think that sort of goes back to some of those pieces about it is important to continue to reach out and to maintain connections, and to do things and keep active, like, going out for walks and, things like that. So I think while maybe some people feel that maybe they're not as maybe motivated to do that kind of thing, I think it is actually probably as important or more important than ever that we keep working on those connections.
Thank you. Are there any other suggestions in addition to those noted, especially finding a purpose to our final years, meaningfully, that is?
So that's sort of a huge question in terms of finding a purpose. But I think one of the things that we're talking about here is the idea of connections and how do you maintain connections, because I think that matters to individuals and it matters so much to the people around them. And, I think one of the things that people can do is to really maybe make more of an effort than maybe ever before to find ways to reach out to their neighbors and their friends and family and, people who are their fellow members, because those connections are important to everyone right now. And so to me, I think that's something that's really valuable at this time.
Thank you. This will be our last question. How about a composite list of coping strategies available to members?
So I think that's great. Like, we've put together some different lists before of things that people can do generally around the idea of loneliness, but we can also provide some information around some of these issues around connection that might be helpful as well. And I know that the RTO-ERO is already doing this in many different ways, but I think what we also heard is people appreciate that kind of information on an ongoing basis. So maybe it's time for an update on some of that. And I think that's an excellent suggestion.
Thank you. Thank you to everyone who joined us today for your time and attention and for being part of a great discussion. And I'm certain I speak on behalf of everyone when I say a huge thank you to Dr. Paula Beauchamp and Dr. Rachel Savage, and as well you, Andrea, for stepping in for Rachel, for taking time to present today. I have known both Paula and Rachel for several years, and I must say that I am continually amazed at the dedication and passion that is so evident anytime you speak. Finally, I want to add that it is through the generous support of our donors that the RTO-ERO Foundation is able to continue to do its work. This work includes our grant program that supports research and community initiatives to create a better future for older adults, and also to bring presentations and dialogue like today's webinar for you. We have another webinar coming up in June, so stay tuned and watch for those registration emails. And if you'd like to help support us, you can find us by Googling RTO-ERO Foundation or calling us at 1-800-361-9888 extension 271. Thank you again, Rachel and Paula and Andrea. If there's anything you'd like to add before we finish, now's the time.
Well, just to say thank you so much, Joanne, and thank you so much to the RTO ERO for all of your ongoing support for the work that we do and for research and for helping so many trainees and researchers across the country. Much appreciated.
You're
A
welcome.
big thank you to the membership for being so wonderfully engaged and interested. It's fantastic.
Thank you to everyone for joining us today, and please stay healthy, stay safe, and maybe now that you've been through this webinar, you might think of calling somebody who lives alone. Until next time, goodbye.